The government has been warned against moving areas out of the toughest local lockdown too soon, as it prepares to announce a review of the tier system today. Health experts warn that more people may need to be restricted to help stop the spread of the virus. Joining us now, Professor Maggie Rae, President of the Faculty of Public Health. Professor, lovely to see you this morning. I do hope you're well. I just wonder what you might make then of the strategy as it stands, of the tier system, but indeed of the idea that we may well see some tiers, some areas changing tier today when we're within spitting distance of Christmas.
Well, good morning, Neil. A great pleasure to be with you this morning. I think from my perspective, there's two messages. There's 8 sleeps to go to Christmas, and so we're very, very close to the big day. And we know what happens with this virus. It runs ahead of us. It's run ahead of us the whole time since last January. So we do need to avoid mixing indoors. That is the most dangerous thing we can do. And not just thinking about Christmas on the 25th of December, I'm thinking about that date on the 8th of January, where we will see the consequences of any mixing that we have now and up to Christmas. So I think we've given clear messages about how we avoid contracting the virus, stopping the spread, and as many people as possible, please take that advice.
Is it then advisable, given what you're intimating, that we are going to see a rise in infections, that we will see a rise in hospitalisations and everything that follows from that? Wouldn't it have been better, perhaps, for the Christmas window to have been revised?
Well, I think there's a dilemma, isn't there? Because the government had given people the message that they could meet in small groups of households mixing before Christmas, and I suspect they've taken the decision that it would have just been too complicated, and many people had already made their plans. As I say, we're very, very close to the big day. But let's not underestimate what we can do to minimise the harm. We all have to make these decisions now ourselves. We all have to protect our vulnerable relatives. But I think the message that I haven't heard enough of is lots of people in health and social care, my own colleagues in public health, all those key workers, they will be working all through Christmas and New Year. They will be working round the clock, 7 days a week, 24 hours a day, protecting the public's health. But they've also got an additional task now, and that's to roll out this wonderful vaccine that does give us hope. Most of our elderly and vulnerable have only had 1 dose of the vaccine, so they're not yet protected enough. But let's not distract them by adding more cases into the mix. We can all take responsibility, we can all be careful, we can all make sure we're distanced, washing our hands, wearing our face coverings, and this does make a big difference. So if you have taken the decision to mix households, please take the advice. And again, if you can meet outdoors, that's so much better. And do please keep your houses ventilated. That also helps.
Just on your point there about meeting outdoors, we understand, of course, the dangers of mixing indoors, particularly when you're mixing with people who are outside your own household bubble. But just considering where the infection rate is at the moment compared to the beginning of the year, are we safer? Is it safer or more dangerous for us now than compared to the beginning of the year, now compared to March, I should say? Is it safer or more dangerous for us to be spending time with people, with anyone, outdoors?
Well, I think we know there is a safer element outdoor, provided we're distanced. That's the key thing, and provided we're wearing our face coverings, and provided we are washing our hands and taking all of those precautions. But we said at the beginning of this virus, we would see several waves. And I think anyone looking at the data and information at the moment would see that we're in a 3rd wave. You can see the cases going up. We know there's many more people in hospital, and we know that it is extremely difficult for the NHS and social care to cover the months that are the January and February. That's a very difficult time of year anyway. So really putting yourself at risk with meeting with people that aren't in your own household does present the potential for the virus to spread.
Professor, just speaking more generally about public health strategies, do the public tend to respond in the way that public bodies want? Do they tend to respond better when they're told what to do, as, for example, was the case, with the first lockdown, for example, or when they feel that they have agency over their own decisions based on information provided, as is the case with Christmas?
Well, I think my lifelong experience, all my working years in public health, tells me that we need trust with the public and we need to engage with the public. We need to understand how the public, people in the Great British public, how they lead their lives. And for many people, their mental health problems, their loneliness, the fact that they've made plans and are looking forward may result in them taking the decision to mix households. Most people in Britain are rule-bound. We follow the rules. I think it's our job, and I think the media, talking about this morning, Neil, I think can be a great help to people. I think we have to keep putting the messages out about what's safe to do, what's not safe to do, what's within the rules, what's not within the rules. But at the end of the day, it is called the public's health for a reason. So it's really up to all of us in the Great British public to do the sensible thing.
A good point, well made. Professor Maggie Rae, good to see you this morning. Thanks for being with us.
Thank you so much, Neil.